Hi, everybody. I am here today with our alum, Jeri Bates, who is going to give us some insight into her current career. Jeri, thanks for being with us and give us a little bit of your history.
Thanks. Thanks so much, Jennifer, for inviting me. I appreciate it. I am a graduate of CSP. I graduated in 1991, which was so long ago, with a degree in sociology and two minors, one in communications and one in history. The history was kind of accidental. I just had a lot of electives, so I took it. Um, I currently work in the medical device industry as a talent acquisition specialist, which is the stunningly beautiful way to say recruiter. And I do support our medical device recruiting. And that is kind of my career history, actually, within human resources and within recruiting overall.
So you are hiring CSP graduates, or you're at least maybe one of the first stops that CSP graduates might find when they're putting applications into different exercise and technology and fitness and wellness fields. So tell me from your end, what does a typical day or week or month look like for you? And then maybe for some of the people that you might be hiring for.
Yeah. So I do a lot in internal partnering with my managers that I'm working with. We dig down deep into what the role is all about, what I'm looking for, what the managers are looking for, how a person will fit culturally within the medical device industry and into that position. So we look a lot at the hard skills and soft skills for the roles. So my day could be as blasé as talking to candidates and interviewing candidates as kind of working from a sourcing perspective to find the right candidate, to partnering with our managers to make sure that they are getting their needs met in regards to hiring employees. And it's never the same. Some days we're in a panic, some days we're not in a panic, but it's one of the cool things about being in recruitment and HR is this just the diversity of work overall, and then really just the diversity of the people that you meet, which I find fascinating. I have never gotten tired of working with people throughout my career, so that has been fantastic. In looking at it from the med device industry, it's really dependent upon where you assign your skills. We do a lot with engineering because we do a lot with manufacturing, but we also do a lot with kind of that health science perspective and life science perspective. We have a lot of clinical positions where our clinicians might be working with case or trial studies on how a device is going to be built and work in a human person's body. So they do a lot of rapport with clinicians and what we call key opinion leaders in the field to talk about what the device should do or how it should work with our patients. They also do a lot of patient connections and communication, a lot of documentation and quality from that clinical perspective. We have clinical field specialists that are actually in the procedure rooms with the devices themselves, training a cardiologist how to use the electrophysiology ablation catheter appropriately. We have commercial sales teams where we'll have salespeople that come to us from a life science background that sell our medical devices. We actually have life science people that love the quality and documentation process and come in and work in our regulatory fields. So you may not even think of a medical device company when you're looking at your degree, but the potential for different positions are out there.
Yes. And would you say that a master's degree is required, or are you hiring entry level, or where are you seeing the openings being that you're looking to fill?
We probably put preference on a master's degree. There's a little bit more, I would say, logical thought process and probably a stronger understanding from a life science or biological science perspective. That's a much better fit for what we're looking at, especially when we look at the clinical fields. Our clinicians and clinical field scientists are probably master's and PhD degree holders for the most part. And it just makes sense. I think the level of respect as they partner with clinicians and key opinion leaders and have that advanced degree is a key piece.
Yep. Nope. That totally makes sense. You need to, yeah, be able to think at a little higher level, and that's what higher education does for you as well, right? So it
Yeah,
gets you ready.
exactly.
So
Exactly.
if we have students who are undergraduate students in sport management or exercise science or sports psychology, thinking about how could I fit into the medical device field? What have been some examples of previous jobs that you've hired for? Maybe you know the titles, or areas or categories?
Yeah, I would say we would probably lean most strongly towards our clinical perspective, mostly because that type of background has a better understanding and a better working day-to-day knowledge of anatomy and physiology.
Mhm.
Those are key pieces. We're building devices that go into people's bodies, so we need our R&D team and our R&D engineers to understand if you're building a piece that's like this, how will that get to where it's going? So that strong understanding of anatomy and physiology is key. We even utilize it, and they partner closely with our R&D team when we look at particular like metals or plastics that we use to introduce into the body. So there's a chemistry component there. But again, it's thinking of, if we utilize that, where is it going and how is it going to get there? And what could be the potential impact on the physiology of our patient?
Yeah, fascinating.
It's pretty
And
cool.
the general public is very thankful for all the stuff that goes on behind the scenes, right? That we have no idea about.
Yep, exactly.
Jeri, what would you say, or let me think about how to phrase this. If our graduates are thinking, gosh, what she said has triggered some interesting, I want to do a little more investigation.
Mhm.
Who are some of the big players in the industry, or where are you? And if you feel like you can speak about it, where do you think the industry is going to go in terms of technology or next steps? So where should our
Sure,
grads
sure.
be? Who should they be thinking about? What are the big
Yeah,
names?
that is a great question. What's kind of nice is the Twin Cities is actually a hotbed of medical device industries. We have big leaders such as Abbott Laboratories, who I work for, Medtronic, Boston Scientific, some smaller groups that are here in the Twin Cities that are probably more from an R&D perspective, but we do a lot from a medical device standpoint here. So even just trolling through their websites and seeing what they have from a divisional standpoint, from a diagnostic standpoint, from a device standpoint is key to kind of understand, ooh, that looks interesting. Is that something that I, could take a look at? So I think that that's a nice way to take a peek at that. Another thing too, from a future perspective, when we look at the industry of medical devices, we make leaps and bounds literally in months and years with iterations on medical devices, with new things that are coming up. I would say a key piece that I've been seeing and hearing is really more from a biometric standpoint in helping to manage your health every day. You see like Dexcom and Abbott's Freestyle Libre, which monitors your blood glucose. So we look at opportunities for utilizing that same type of functionality to look at everyday health. Are you getting enough sleep? Are you getting enough food? Are you getting enough protein? Are you getting enough exercise? So those key pieces are going to be the future, I think, from a medical device industry standpoint, is continuing health.
And that's so fascinating because that is so evidence-based in many of our classes. There's theories and then there's whims and then there's social media influencers. But if the evidence can really speak to you with the data you collect, that's going to inform your decisions and your future plans for
Mm-hmm.
sure. So it's
Yeah.
cool to see that come full circle.
Yes, very
Yeah.
much so. And I think it's more in looking at it from the perspective of a partnership. Yes, we build medical devices. Yes, we want to utilize those medical devices, but what are ways that we can help, hopefully, in some cases, prevent the need for those medical devices?
Mhm. Moving on to some hiring practices, what are you looking for? So you're sifting through resumes or taking phone calls. What is going to set a student apart, or what are some things that they can even do as an undergraduate student, volunteer wise or leadership wise, that's going to be, a thumbs up for you when you see their candidacy come across your desk?
Um, I would say anything that's involving leadership or activities. My most successful hires from a new grad perspective, be it undergrad or graduate level, have been students that have gone to school and been involved in leadership activities or sports that they've worked. I put more weight on someone that can manage their time and still come out on top with an advanced degree and a high grade point average than someone that has the luck to be able to maybe not have to work through school. So definitely being involved as much as you can in extracurricular activities or work or volunteerism is a key piece. It just shows kind of a well-rounding and a time management skill that's there. Communication is key. We do so much from an electronic standpoint. And, I can definitely see that. And that's helped speed things up and create quicker pathways for communication. But when I look at the med device industry as a whole, you have to connect with so many differentiating teams like R&D or regulatory or compliance. And everybody has a set agenda or a business purpose in mind, and you have to be able to share that information with them and collaborate with them beyond chit-chatting through Teams or sending an email. So definitely having those strong face-to-face communication skills and collaboration skills are key.
And what would you say on your own personal journey have you learned, either personally or professionally, as you have made your way up in your career?
I would say, and it took me a long time to learn this, is learning to ask for help. And I think people hear that all the time. We say it all the time. I even say it when I'm talking with candidates or when I'm talking with the teams. But it's hard to do that because you're afraid of being seen as a failure. But I have learned, and I'll give a case in point. We had a large expansion during COVID to build our rapid response COVID testing. So we were hiring like 300 people in a month, and then 300 people in a month, and 300 people in a month. And you can't have any surprises in that process. We had to get this done. And so we discovered that if I let my senior leadership team know where my concerns were from a project timeline, they were never surprised when we got to kind of like where in the process we were. So if you can share that information, if you can be honest and say, I'm struggling, I need help, I'm going to be late, I'm going to be early, anything you can do from a transparency purpose to share and I think just to share is really just a key piece, because I was never seen as a failure. I was always seen as someone that was on top of the situation because I was being forward thinking with what you were doing. So always ask for help. And I may be asking for help is the wrong word. Ask for assistance, ask for, guidelines in regards to the scope of the work that you're doing so that you can stay on track. But never, ever let your senior leadership be surprised by anything that's happening with the stuff that you're doing, especially if you're leading in projects.
I think that goes across the board. I can have
Yes.
some flashbacks to some of my previous employers too, and they found out something that didn't come from me, but it should have come from me, and I definitely learned in a hurry for sure.
Yeah.
How about either for you or thinking about the people you hire? What is something that you weren't told that you wish you would have been, either positive or negative, like something that you learned now kind of through trial and error, or applying it to the people that you communicate with and work with? What is something that you kind of learned on your own?
Wow. I gotta think about that one a little bit, even though you sent me that question. No, I'm kidding. I would say you kind of you don't learn the hard way, but you learn how strong and how important it is to have a team that works well together. I mean, I'm sure that managers try to hire for fit, but once you get that team that's together, learning to communicate with that team that you're working with is a key piece. And that means having their back, sharing information, making it not a competition. Friendly competition is good. That's okay. That's kind of fun on your team. But I think just learning the hard way with the team that I had early in my career, where it was a competition and it was like real backstabby and very uncomfortable and not very communicative, and everyone told on everyone else. I think making sure that you have an understanding of what your needs are, you have an understanding of what the team's needs are, and that you can talk collaboratively with that team and have that trust. That trust is key. If you're not getting that, being able to go to your manager and say, this is not happening, and hoping that something will come from that, but definitely being able to share that. But that team connection and that team trust is key.
And that doesn't happen overnight, and that
No.
isn't something that can just show up on a list of duties and you can magically do it. You do learn through trial and error.
Yeah,
for sure.
very much so. And when you look at companies, you can tell by your senior leadership, what kind of teams they worked for and who they supported and how they collaborated with them. by the fact that they're leading their teams now. So I think that that is a key piece to think of too. You don't always get ahead by stepping on the person next to you or below you.
Very good point. So you mentioned communication and critical thinking as two characteristics that you are looking for. What else do you think is important for a health professional to embody? So again, you've got these 100 resumes. What's going to set somebody apart?
Sometimes it's not even necessarily on the resume, it's when I talk to them. So it's having an understanding, number one, of the company that you're interviewing for. That's a key piece, and that's a key piece really for any candidate that we talk to. But then being able to put into words why what we do is could be a passion for you or is a passion for you. It's really understanding that, at heart, particularly in the med device industry, yes, we're a manufacturing company. We manufacture products that provide for a healthier life or a better life or a better lifestyle. But in the end, these are patients that we're serving. So really that passion for the medical field really is a key piece. That patient perspective is a key piece. Knowing that everything that you do feeds into something that will save someone's life is a key piece. And I think that's the same in any medical area, is that patient focus and that patient passion.
Yes. And what would you say? We'll wrap up here, but if a new alum was coming to talk to you, because we love to have our Concordia alums chat with each other, or somebody who, for instance, is maybe finishing their final tomorrow and they are feeling a little adrift. Looking back, 30 years ago to when you were in that spot, what comes to mind? What do you wish somebody would have told you, or what would be some advice for a new graduate?
Yep. I would say, especially now with being as technological as we are, definitely update your LinkedIn profile. Recruiters use that a lot for cold searching and just searching in general. So keeping that updated, providing up-to-date information is key. I would say, start researching companies, reach out to alum or people that that are in areas or industries that you're interested in. Networking is a huge thing overall. I think we find more people from internal referrals and internal networking for positions than anything at all. So definitely don't be afraid to, reach out to people. I mean, if I would say for your alum, if you were on LinkedIn and you were looking up CSP alum and my name popped up as a recruiter, I would connect right away, whether or not the industry is the one that you're interested in, because I betcha that recruiter knows some other recruiter in an area that you might be interested in. So again, it's kind of tying in with that networking piece. And, in reaching out, it doesn't have to be like a full, long blown resume and email about everything that you're interested in. It could be as simple as, I'm a CSP alum, you're a CSP alum, I'm graduating, you're in the med device industry. What can you tell me about the work that you do? And then kind of work it from there. So I think that key piece, the LinkedIn profile, networking with people are probably the two biggest things. I wish we would have had LinkedIn when I was graduating, but I also wish I would have networked way more than I did.
Folks, $1 million answer for free right now. So thanks so much, Jeri. Is there anything else that we haven't touched on that you want to convey to students who are watching this for a class, or watching this as they think about their next steps?
Like I said, definitely update your LinkedIn profile, update your resume, keep your resume updated throughout your career. You just never know, and it's not a bad thing. If you want to do that, and take the time to search around to see things that you're interested in. Companies will post positions based on keywords, so you can do keyword searches at Indeed and everything like that. So things that are out there that you wouldn't even think of, you just have to put a little bit of time into finding them. And I think that's a key piece too. It's not super easy. You have to invest the time in it, but it's out there. The information is out there.